Hello everyone, my name is Elizabeth Barta and this will be a video about injection types, including needles and layers of skin. To do so, I'm going to be using bananas, as well as an 18 and 20 gauge sterile needle and a 6 milliliter syringe. I have two liquids that I'm going to be using, a red and a brown. To show these, I'm going to specifically show an IM and a subcutaneous injection. I drew this dandy little chart of different tissue layers. So in orange on the top, we're going to have the epidermis. In pink, we're going to have the dermis. And in yellow, the subcutaneous tissue. In blue will be the muscle tissue. To do an IM or intramuscular injection, you want to use a 90-degree approach on injection. And to do a subcutaneous or sub-Q injection, you want a 45-degree angle. For an IV injection or intravenous, you're going to use a 25-degree angle. And for an intradermal or ID, you are going to use a 10 to 15-degree angle. So I'm going to start off with my needles. This is a 20 gauge 1-inch needle with an aluminum hub. I'm going to break the protective seal on here and open it up. Maybe not. These are sterile needles. But for this, they're going to work. Maybe. So I have my 20 gauge 1-inch needle. And I have my 18 gauge, if I can get it open. Then my 18 gauge 1-inch needle as well. Now I'm not using these in a sterile setting, obviously with my bananas, so I'm not worried about touching the aluminum hubs or the needle itself at this point. But if you are actually doing this, I would highly recommend not doing that and wearing gloves. So I'm going to get my 6 milliliter syringe. I'm going to start with my 18 gauge needle. And I'm going to do a intermuscular injection on this banana with my red fluid. And you would commonly use an 18 gauge needle for thicker fluids like Exceed or penicillin, just because it does have a larger diameter than a 20 gauge. Ironically, because 18 is smaller than 20, but with needles, the diameter is opposite of the gauge. So I'm going to draw up 3 milliliters of my red solution here. And I'm going to do an intramuscular. So I'm just going to go at a 90-degree and slowly inject that. I'm probably not going to do all of it because that was actually a large amount. So what we're looking for is when we cut this banana open, that the fluid is going to be roughly in the middle layer. I'm just going to recap that. Take that needle off. I really need to clean this syringe out. We're just going to do that. And then I'm going to grab my 20 gauge. And you can see it has a smaller diameter. I'm going to draw up some of my other liquid. I drew up a little less of this one just because I know I'm not going to need it all. Make sure there's no air in it. I got about 2 cc's of this, and I'm going to do subcutaneously. So I'm going to just go right under that skin layer, or the dermis layer, at about a 45-degree angle. And just give it a little push. It doesn't take a lot of this fluid to show these. And when it squirts out at me, I'm going to stop. Cap that needle back. Take it off. Wipe up all the stuff off my fingers. And as you can see, this one's just from spewing out. You can already kind of start to see where that fluid went. This one you can't see it as much, but we're going to cut it open or peel them and just verify that we gave the injection the correct layer of skin. So I'm just going to peel that. And you can see where it pierced the skin. And I'm going to give it a cut. And you can see that I went down into the muscular layer for an intramuscular injection. That one. And on this one, I'm going to cut over here and just peel back the skin, since this one should not have gone into the actual banana itself. And this one is a lot harder to see, but you can see where this brown spot is where I injected that brown fluid. It was kind of the best I had, so sorry it's a little bit harder to see, but you can see right in here, that's where that brown fluid dispersed. And if I cut it open, like I did the other one, this is a very seedy banana. You can see that there is no fluid inside of the banana. It is just on that subcutaneous level. So that is a little bit more about how to give injections and the different types.